1017 FM and 710 Keel, Robert and Erin, as we say all the time, because we are forever in their debt. Guests on Keel heard via the Jack Spring Electric Keel Newsmaker hotline.
Our 2020 winner.
Of the most frequent guest, yeah. Dr. Martha Whyte, State Office of
I heard. That's exciting.
I'd like to say you get a trophy
Or we pay you,
lunch at Papa's, I think is the least we could do. Dr. Martha Whyte, Regional Director, State Office of Public Health. So it's the vaccine this week will be even more widely available. In what numbers? Where? Explain to us this week's deal.
Man, I wish we hadn't had that press conference on Wednesday. Yes, their goal is to get this vaccine to people 70 and over as quickly as we can. The limitation is the amount of vaccine that comes into the state. So right now they're putting in over 110 pharmacies across the state, about 100 doses each, which is not a whole lot when you think about all the people over 70. I think in my region, my 9 parishes, I have about 65,000 people
Dr.
over 70.
Why sort of a two-parter here. Is that Moderna? Is it Pfizer? And why the slow distribution, or is it?
So it's Moderna is what will be going to the pharmacies. And the state is getting X number of doses from each, a certain amount from Moderna, a certain amount from Pfizer, and they have to parcel it out by, the best they can. So they're still finishing up phase 1A. They're moving into phase 1B, which is a huge group. If you saw it, it's, police, government, your public works, your teachers, your people over 70, your
jailers,
home health, and dialysis centers. So it's a huge group. So it's trying to make sure that we're starting to touch on these major groups first. And he has prioritized healthcare workers who are independent, so they're not part of a hospital system, people over 70, and then your non-medical first responders are in that first group.
Okay, you know what's happened since Wednesday. Drugstores are getting bombarded. We're hearing people have lined up. Where in our area, can you give us any information about the drugstores in Region 7 that will have this vaccine?
So I didn't make the list. The pharmacies were contacted out of New Orleans and had to agree to be that pharmacy. I think a lot of people are aware of some of the sites. They're going to be on our LDH website sometime today. I'm hoping sooner rather than later. But please don't go wait in line. They're not going to be able to give it to you that way. You're going to have to make an appointment. So if you go wait in line, you're wasting your time. Call, see if they have it. When you see that, when it comes up on the website, call and make an appointment. And know that even if they run out, they'll put you on a list because they're going to be getting more.
Do you anticipate it'll be about 10, 12 pharmacies in our region?
So there'll be at least one in every parish. So that's 9 right there. But then for like Caddo and Bossier, I think there'll be multiple because they're bigger cities in those parishes. But they're also trying to get the rural areas as well. So I think we're going to be above that number.
Okay.
But, it's still...
Dr. Martha, pardon me.
Hard to come by.
How did they determine what drugstores will and or will not? I mean, is it going to be like CVS outbid Walgreens? Is it anything that is... explain to everybody who will get those or exactly the process of why they will get.
Really what they were trying to do is make sure that they could touch on areas, all areas of the parish. So, or at least get part of the rural parishes as well. They wanted to have people have some sort of access. So that's really what they were looking at, was access points. It wasn't a bidding issue, and they actually had to ask the pharmacies if they were willing to do it. Some of them really just don't have the capability. You know, you're telling me people are calling and lining up. They've actually all been calling me.
Right.
And messaging me on Facebook, people I don't know, bless their hearts, trying to get information. And that's what the difficulty was about announcing it on Wednesday, when there's no one there to answer your questions till Monday.
Mm-hmm.
So it's coming. The information's coming. The other thing I want to let y'all know is we're going to be doing some public health with LSU and a lot of other volunteers that are helping us. We're going to be doing some drive-through clinics, hopefully starting next week, for the same group, anyone in that group 1B. So pay attention for that. Hopefully we'll be able to get that plan agreed upon by the state level, and we'll be able to start offering vaccine that way as well.
Okay, and you have more vaccines on the way. I know this is limited, this first, starting today, 100 vaccines per pharmacy will probably be gone in day one, I would imagine, but more vaccines are coming.
Right, they'll get more, as well as we're going to offer it through some drive-through sites. And eventually, you know, the goal is to really get a good flow. But until it starts really flowing into the state, it's just, we're just going to all have to be patient.
And don't try to get in line now if you're not on that list. I mean, don't try to say, "Oh,
Don't block the drive-through with your Escalade."
Yeah.
I was talking to
really,
Erin, actually.
They won't be able to help you if you do that. You're going to be disappointed, and you're going to be frustrated, and then you're going to frustrate people who did it the right way. So just wait till the list comes out, or you can call your pharmacy if you go to one regularly and ask them. But they're also trying to do their daily work. So remember, everybody's stressed and pulled thin. Mm-hmm. Give everybody a break. Be a little bit understanding, and they'll work with you.
And if you've had COVID in the last how many days, you don't need the vaccine right now. Can you answer that one?
So what they're saying is 90 days. If you've had it in the last 3 months, you're at a better place than most people who have never had it. So if you can take a step back, wait till more vaccine comes into the area, that would be beneficial. If you are really high risk and you had a very mild case, we understand your desire to get, and your doctor's desire. Just realize you do have antibodies, and there are people who may not have any.
Gotcha. Dr. Martha Whyte, starting off as our top guest of 2021.
You and Royal, it's 1-1 right now. Congratulations in advance. You're in the home. Lunch at Papa's is yours for the asking. Erin says she'll pay.
Yeah.
Dr. Martha Whyte, great as always. Thank you for your time, man. We'll see you soon for sure.
I'll take care.
101.7 FM, 710 Kilo. I told people you have an Escalade. You don't really.
No, I don't.
It's about a 10-year-old Hummer. 101.7 FM, 710 Kilo. Here's Ruben.
Keeping an eye right now on some slow-moving traffic on North Market near North Hearn Avenue, and we have some traffic delays on Airline